What is a UTI? Urinary tract infections are bacterial infections that can affect any part of the urinary system. Lower urinary tract infections consist of a bacterial infection of the bladder or urethra. Upper UTIs consist of an infection of the kidney or ureter. Lower UTIs are more common than upper UTIs and have a lower risk of the development of complications than upper UTIs. Over time, a lower UTI may progress to become an upper UTI. What causes a UTI? Bacterial infection of the bladder, urethra, ureter, or kidneys is the root cause of a UTI. The infection most commonly originates from the urethra, however. In rare cases it may be as a result of infection via the bloodstream. This is uncommon. In women, sexual intercourse is a common cause of a UTI. Most UTIs in women are acute uncomplicated cystitis caused by Escherichia coli, 86%, Staphylococcus saprophyticus, 4%, Klebsiella species, 3%, Proteus species, 3%, Enterobacter species, 1.4%, Citrobacter species, 0.8%, or Enterococcus species, 0.5%. Who can experience this condition? UTIs are more common in women than men. Statistics show that more than half of women will have at least one UTI in their lifetime, while 1 in 3 women will experience a UTI by the age of 24 years. For men with no underlying health conditions, only 1 in every 2,000 will experience a UTI each year. This large difference between the two genders is due to the wide variations in the anatomy of their urinary system. The female urethra is shorter than in males, and so it is easier for a bacterial infection of the urethra to spread to the bladder in women than it is in men. A woman's urethra is located closer to the anus, making it easier for the bacterial cross-contamination of pathogens such as E. coli to originate from the anus to infect the urethra. Sexually active females are at a greater risk of contracting a UTI. Sexual intercourse may irritate the urethra. Bacteria may be able to pass through into the bladder more easily, resulting in the bacterial infection of the bladder known as cystitis. Furthermore, the use of the diaphragm, spermicide, or condoms that contain a spermicide may increase the risk of developing a UTI. The diaphragm can prevent the bladder from emptying properly, while spermicide may irritate the vagina and make it more vulnerable to infection. Postmenopausal women have a higher risk of developing UTIs due to hormonal changes that affects the lining of the vagina. Aside from gender, there are a number of other risk factors that may place a patient at greater risk of developing a UTI. If they have an underlying health condition that weakens the immune system, such as diabetes, HIV, or cancer. If the patient has a urinary catheter, this is a tube inserted into the bladder to remove urine from the body. If patient has a condition such as kidney stones that obstructs or causes a blockage in the urinary tract. If a patient has a condition that prevents them from fully emptying the bladder, such as an enlarged prostate gland in male patients. What are the symptoms of a UTI? Lower UTI symptoms include a need to urinate more frequently, either during the day or night, or both pain or discomfort when passing urine, an urgent need to urinate, cloudy urine, unusually unpleasant smelling urine, blood in the urine, abdominal pain, a feeling of tenderness around your pelvis, back pain, a general sense of feeling unwell. Upper urinary tract infection. The symptoms of an upper UTI include a high temperature, fever of 38 degrees Celsius or above, uncontrollable shivering, nausea, vomiting, diarrhea. Patients can also experience pain in your side, back, or groin. The pain can range from moderate to severe, and it is often worse when urinating. A lower UTI can develop, and the infection may spread from the urethra or bladder to the kidneys or ureters. Therefore, it is not uncommon for patient to display symptoms of both an upper UTI and lower UTI. When should you refer someone who presents with a UTI? Treatment with an antibiotic is recommended to treat both lower and upper UTIs. If a patient presents with cystitis that may be caused by a lower UTI, there are a number of treatment options available over the counter. This will be covered later in the video. If the patient is male. If blood is present in the urine. Although unlikely, this could be a symptom of bladder cancer, so it is important to rule out or confirm the diagnosis. A person with symptoms of a lower UTI and the symptoms are not improving. More symptoms appear or they suddenly get worse. A person displaying symptoms of an upper UTI should be referred immediately. There is a higher risk of complications with an upper UTI. If a person presents with a lower UTI or an upper UTI and has any underlying condition or risk factor that predisposes them to an increased risk of complications of a UTI, they should be referred to their GP. These risk factors include a weakened immune system, immunocompromised, caused by treatments such as chemotherapy, or a health condition such as HIV, kidney disease type 1 or type 2 diabetes, kidney stone, a foreign body in your urinary tract, such as or an indwelling catheter, a tube that is used to drain the bladder, being pregnant, being over 65 years of age. What are the treatment options available? OTC. Over-the-counter, OTC, pain relief medications can be used to relieve symptoms of UTI such as abdominal pain. Treatment with an antibiotic is recommended to treat both lower and upper UTIs. In addition, drinking plenty of water, somewhere around 6 to 8 glasses or 1.2 L of water a day to stay hydrated, is an important part of self-management and patient care. For patients presenting with symptoms of cystitis that may be caused by a lower UTI, there are a number of treatment options available over the counter that may be used in combination with OTC pain relief, if it is required. This will be covered in further detail later in this video. First-line pain relief for patients experiencing the symptoms of a UTI is paracetamol. Patients should be counseled on the correct dose and warnings associated with this medication. The daily dose for paracetamol is 1 g up to 4 times a day when required, and it should not be consumed with other paracetamol-containing products. While NSAIDs such as ibuprofen can be very effective at relieving pain, for patients who present with a UTI, the use of NSAIDs is cautioned as it may reduce the blood flow to the kidneys and increase the risk of developing complications of the disease. Are there alternative therapeutic options such as probiotics or multivitamin preparations available to prevent UTIs? There are probiotic formulations and food supplements on the Irish market and available from pharmacists that can be used to optimize female health in order to increasing the odds of reducing recurrent UTIs. A woman's intimate area is composed mainly of a bacterium called dodylene bacillus or lactobacillus. Lactobacilli provide protection against infection in the vagina by producing hydrogen peroxide, H2O2, and lactic acid. These two substances prevent the proliferation of other pathogenic germs such as E. coli. One such example is Bioccult Procyan. Bioccult Procyan is an advanced triple-action formula containing cranberry extract, live bacteria, and vitamin A. Probiotic formulations are designed to target the urinary tract to achieve and maintain the microbiotic balance in this region and reduce the risk of infection. This product contains 2 lactobacillus strains, Lactobacillus acidophilus PXN35 and Lactobacillus plantarum PXN47. The use of cranberries, cranberry juice, and cranberry extract to fight off recurrent UTIs is based on long-standing traditional use. Proanthocyanidins present in cranberries are thought to prevent infection-causing bacteria such as uropathogenic E. coli from attaching the cells that line the urinary tract to protect against infection. Cranberry-containing products should only be used by patients taking anticoagulants such as warfarin under the supervision of a doctor. GP referral should be offered as necessary. Vitamin A contributes to the normal function of the immune system and the maintenance of mucous membranes, which can be found lining the urinary tract. Suitable for children and pregnant women. We would always suggest consulting your doctor or healthcare practitioner before taking any food supplement. What can patients do to help prevent recurring UTIs? The following advice may be useful in helping you to keep your bladder and urethra free from bacteria. Go to the toilet as soon as you feel the need to urinate, rather than holding it in. Wipe from front to back after going to the toilet. Practice good hygiene by washing your genitals every day, and before having sex, empty your bladder after having sex. If you are using a diaphragm or spermicide-coated condom as your main method of contraception, another method of contraception could be considered. Treat constipation promptly. Constipation can increase the risk of developing a UTI.